MDD, right. Bipolar disorder. One of my major, I think in somewhere in the beginning I told that major complaint is that there is under treatment of major depressive disorder and over diagnosis and then over treatment of bipolar disorder. That is what happening at present in our community. This is my impression. Some of you may not agree with me, but still that's what I feel. Especially when it comes to bipolar depression, I think we are messing it up like anything like that. Sad, very sad. With the suicidal risk of 15%, the 1,000 different opinions, and then everybody has got his own different opinion, and then not like people, we don't get a clear-cut guidelines. And then I don't go into the details. That's why I said that enough controversies I'm not going to talk about. Briefly, I'll touch on this. Bipolar 2, I wanted to touch. Sir, again, this is not a relevant forum. For me, those few of you who are sitting with me here, bipolar 2 disorder is a myth. This bipolar 2 is going to go away from the classificatory systems. Maybe it's a matter of another 5 years or 10 years. Bipolar 2 is not going to be there. I've been talking about it. Now slowly more and more people are talking about it. It's a myth. It's a myth we have created some time back, and it's time that this should disappear from the classificatory systems. It is doing enough and more damage to patients with MDD. I'm repeatedly telling the patients with MDD are wrongly being diagnosed with this hypomanic spells as bipolar disorder 2, and they don't get antidepressant treatment. Right. DSM-5, only hypomanic episodes are not. One episode of mania is enough to diagnose bipolar 1. 1,000 episodes of hypomania are not enough to diagnose bipolar 2. You need to have at least one episode of MDD. Definitely, one episode is a must. And then for the number of days of MDD, number of days in hypomania, for every 33 days of depression, there's 1 day of hypomania. That's what the current state is. Let's see that. The reason why I talked about is that when you diagnose bipolar 2, you don't give them antidepressants, you don't give them SSRIs, you talk about quetiapines and all those things, right? Bipolar 1. The reason why you don't give antidepressants is that two things. One is efficacy. Second thing is, are they effective or produce switch? Suicide prevention. Now, I keep the efficacy part aside. I look at the switch part of it. There is a morbid fear that antidepressant in SSRIs, when you give in a patient with bipolar, there is a high risk of switch, and then quite a lot of patients are switching into mania, and the mania risk is becoming more. Now, I'll show you one or two slides, and then where you decide for yourself how it's, like how much of it's going to be. This is a study by Musliner, which is published in ACTA in 2018. This is a 20-year follow-up study where 91,000 patients are followed up. It's a Danish registry. We all know that how they maintain the registries. They followed up for this period. Out of 91,000, 4,000 patients from UD developed BD. That is 8%. This is over a period of 20 years. 8% of the patients from the depression switched into bipolar. Right, these are all things which are not relevant now. So some of you may ask, yes, the reason is maybe you are not using antidepressants in these people. That is why this switch is less. Maybe if you are using antidepressants for all these bipolar depression, switch would have been more. Now I'll show you another slide. Remember this period, 95 to 2015, right? This is the period, and this is the follow-up. During this period, one of the arguments is that maybe you would not have given antidepressants. I'll show you the next slide. Recent trends. These are a very, very latest thing. This is in American Journal of Psychiatry. It's in 2020. It's in publication. If you look at this, prescribing trends for antidepressants in the treatment of bipolar disorder in the best visits, same period. I think we have seen is that, what we have seen is here, 95 to 2016. And what we are seeing here is that 97 to 2016. This blue line shows this is any antidepressant. Over a period of 20 years, the prescription of antidepressant, see how it has gone up. From around 47%, it is going up to 67%. So it's not that now psychiatrists all over the world are not giving antidepressants. They are giving antidepressants. But in spite of rampant use of antidepressants, the switch is only about 8% in 20 years. And you look at this is a more now like a disturbing thing. I think a disturbing thing for all of you. Maybe I am not very disturbed about this. Antidepressant without a mood stabilizer. Red line. People are prescribing antidepressants in bipolar disorder without under the cover of mood stabilizer. This is a trend. This is not any guidelines. This is what is happening. In spite of that, it's only 8%. Now you understand what it is. And then I'll also, because I've talked about this, I'll also show you what is the trend of mood stabilizer prescription in bipolar disorder. This is any mood stabilizer. This is. See the decrease. And this one is lithium, right? Lithium is the green line. Even lithium, which was about 33-34%, it has come down to 17-18%. Lithium is the one drug where it's supposed to be having prevention of suicide effect. So the trend is in the all over. People are prescribing less lithium. People are prescribing more antidepressant, but the guidelines tell us that don't give antidepressant because there's a chance of a switch, and then and that is why I talked about it. That's what I wanted to show. It doesn't correlate with antidepressants related switch. This is another interesting thing which I want to know from you also. But 15% of patients with depression or bipolar, whatever it is, they commit suicide. There are more number of the depression is more common in women, 2:1. More number of suicidal attempts in women. So look at the entire all over the world. More suicide deaths are in male all over the world. The attempts are more in females, deaths are more in males. This is all of us know, but it always baffles me. Why is it that all over the world more males are ending their lives with suicide? What is this? Is the world figures, and then I'll come to India. Look at this, 2004 to 2015. This is average suicidal rate, 10.5 per lakh per year. This is the thing. It's more or less remain the same. If you look at this, in females, the suicide rates are definitely coming down. In the last decade, it's coming down. But see, unfortunately, in the male, it is going up. In women, it's in the decrease. We have to believe this figure. This is a figure which is released by the government of India. So in males, it is going up. Why? What is the reason? Depression is more common in women. 2:1, as I told her, and more men are committing suicide. Of course, for suicide, depression is not the only reason. There are a million reasons you may say that, but depression is the most important reason. So I was always trying to get what exactly the reason why like this. I don't know whether this can give you a kind of some answer. There was no like in a discussion when it comes to that. A woman, when she is depressed, she goes and takes treatment. A man, when he gets depressed, he goes and hits the bottle. He becomes an alcoholic. So he doesn't get treatment. That is one of the theories. This is a very interesting thing. It is in 2016 study, a follow-up from the age of 20 to 50. If you see that, there are two important points here. Number one, annual treatment rate over a period of 30 years. Patients with MDD, the treatment is only in about 40%. On an average, over a period of 30 years, 60% of the patients with MDD are not taking treatment. This is the saddest part of it. Our Niman study also showed that 85% treatment gap. WHO shows that more than 75% treatment gap all over the world. We need to fill this. We only have to do something about it. We need to fill this, right? This is something. Women had triple the treatment prevalence of men. 23% of women went for the treatment. Only 7% of men went for the treatment of major depressive disorder. Is it the reason why more men are ending up their lives in suicide? I do not know. It looks a fairly valid point here. Men suicide is increasing, women it is decreasing. When you look at the treatment, In spite of there being higher number of, the prevalence being higher in women, more and more women go for treatment for major depressive disorder. Men, some reason, do not go, sociocultural reasons, whatever the reason, at least according to this study, this is what the figures. Obviously, when you don't get treated, when you have major depressive disorder, when you don't get treated, the risk of suicide becomes very high. And that, maybe this is the reason. If this is the reason, I think we need to more focus. The public health has to more focus on how best we can get more and more men to get into the fold of treatment for MDD, which is a major public health issue. We need to look at it.